What do you do if you're in a remote location and you are far away from medical assistance and suddenly you find yourself with a medical emergency on your hands? How do you prepare for that? What kit do you require to handle different medical situations? What sort of training do you require? Can you handle it? Do you have the mindset to handle it? Because this is something that you might face and it's always unexpected, and then it might be a problem. In this episode, we are discussing all of these with Walther Meyer from Wildmedix, and I trust that you will find it extremely interesting. Rian Kutsia, Fortis Proactive Defense Solutions. Welcome to this episode. Good afternoon, Rian Kutsia, Fortis Proactive Defense Solutions. And today we're going to be talking about wilderness medicine with Walther Meyer from Wildmedix. Walt, good afternoon and welcome.
Good afternoon, Rian. Thanks for having me again.
Always nice to chat with you. Walt, as I said, we're going to be talking about what you call or what you term wilderness medicine today. So I think before we kick off, maybe if you can just give us a bit of an idea of what you classify as wilderness medicine as opposed to survival medicine which we're going to be discussing in follow-up videos to this.
All right. Yeah, thanks, Rian. Look, wilderness medicine, it's sometimes just called a remote medicine. People tend to think when they hear the term wilderness, they tend to think of, in South Africa, we think of a holiday town where outside of Knysna where we keep old presidents, but that's not what we're talking about. Wilderness, people tend to think of terrain, and environments, so trees and mountains and rivers and so forth. And it can, of course, be all of those things. That's not incorrect, but in medical terms, we really consider any place where you are more than 1 hour away from advanced medical care. In the wilderness. Okay, so if you live in a town and there is no hospital, and your closest major hospital is in one of the big cities, which is maybe 4 hours away or something like that, then you're in the wilderness, although you're in a town. And people tend to forget that. They think a town is urban, It's not at all. So it's all about proximational distance to the nearest advanced hospital. So not a clinic or a primary healthcare facility, an actual, a proper hospital that can perform surgeries and have specialists and have theaters and all these things. So that's kind of how we define wilderness.
Okay. All right. I think that clears it up. So let's kick off. I'm going to ask you, first of all, what would you say are the most unique environmental and logistical factors that make medical self-reliance in a case like this, where you are in a remote vicinity or a remote location? What makes it not only useful but potentially life-saving?
Yeah, you see, it's all about the amount of time that person has. Now, there's the concept that a lot of people will know the terminology, the golden hour, which is a kind of very old saying in medicine. They now speak of the golden period. And the reason for that is if you use the term hour, of course, it makes you think you have an hour. Now, originally, the term golden hour is even used in the city environment, right? It was, the idea is it's from the time the person becomes seriously ill or that they get injured. And we're talking about life-threatening illness or injuries here, right? Not minor things. So from the time this person is in this life-threatening situation until the time they get to hospital. And that was called the golden hour. So let's say a person got injured at 10 o'clock in the morning and the ambulance arrived at 10:30, then you actually have a golden half an hour if you have an ambulance crew, right? You don't have a golden hour anymore. You have a golden 50 minutes. And, sober terminology changed over the years. So I think the challenge is that if you're in a wilderness setting, you're outside the golden hour to begin with. So if, let's say something happened to somebody and you could drag them right away and throw them in the car and go like hell, you're not going to make it to the hospital in an hour. That's, per the definition I gave you earlier, right? So you're already outside the golden hour. Now, keep in mind, some people don't have a golden hour. Some people have a golden 20 minutes or a golden 15 minutes. Some people have a golden 15 seconds, right, or 50 seconds, like we discussed with the bleeding control before and so on. It can be very rapid depending on what has happened to the person. And your job as a first aider or first responder in that situation is to extend that golden period for the person, right? So you want to take the golden 15 minutes and turn it into a golden 2 hours or golden 5 hours or whatever, so that you have enough time to now get that person to a hospital for further care in such a state that they can still be helped. So those are the challenges. It's a pretty serious challenge if you think about it, depending on what's wrong with the person, of course. But it means that the knowledge, potentially the equipment that you need, all of that needs to be significantly more than what you would need in a urban developed city situation, with a functioning system.
It's actually it's easy enough to say the word, but it's actually a hell of a lot more serious than one realizes.
Yeah, it was more serious for city life in a way. I think people sometimes, of course, don't realize that they can be in the wilderness in a city, right? If you think about it, if something happens at your house and maybe there's some other obstruction for the EMS, so maybe there is a riot going on, and the guys can't get through to you, and you're having a heart attack in your house in Pretoria, then you're suddenly in the wilderness in the middle of Pretoria because the guys can't get to you and you can't get to the hospital. Or there's some bad guys standing in the road saying, no, you can't go to the hospital, you have to stay at home and live under your bed in fear, then you can't get to the hospital, and suddenly you're in the wilderness. So it doesn't have to be in the wilds or in a rural area. It could be in a city.
That's actually a bit of an eye-opener, to be honest, because it's not something that you think about, not in that sense. Well,
in the South African context, if you think about it, most of us live in houses that looks like prisons, right? So you've got all the security doors and security fencing, and you've got or a triple security fence with an ostrich and a Great Dane inside there to look after you and all these things. And now you have a heart attack in that house. A heart attack is an example, and you're stuck inside. You can't get to the door. You can't open, and the EMS guys are standing outside. They get there 15 minutes, but you're still in the wilderness because they can't get through all that stuff to get to you. So it changes the concept a bit. Right?
Yeah, and in that way, your own home can essentially become not only your prison, but almost your coffin.
Correct.
That's the truth. That's eye-opening. So, if you're in an emergency and you're now far from help in any of the senses that we've now discussed already, it's very easy for panic to set in. And panic, obviously, almost inevitably tend to lead to making bad choices. And in this case, specifically looking at treatment choices. When you talk about priorities, can you walk us through how you should or can prioritize treatment when you are all by yourself, very remote, far from any assistance, and obviously then also touch on why it matters so much?
Yeah, look, in any emergency situation, whether it's rural or urban, you have to get your priorities in order. So, there are all kinds of these little mnemonics that you learn, you know, like these little rhymes almost in first aid. We like to use these abbreviations to keep people or give people reminders. One would be something like the March protocol, which I'm sure you've heard of. South Africanism is the popular one local is Triple H CABS, which is sort of hazards, hello, help, circulation, airway, breathing, and shock and spinal injuries. So it's just kind of a little thing to remind you in which way to look at your, you know, your injuries. But pretty much everything always starts with severe bleeding. All right, you've got to get severe bleeding under control. And you have to have a little bit of a knowledge of this, especially in the wilderness. Things like temperature control and bleeding control are actually quite tightly related. So a lot of people don't realize that. Then there are maybe other skills as well, something like tractioning a femur fracture or whatever. That would be a bleeding control skill. It's not a splinting skill. And so having that sort of extra knowledge, it's all about bleeding control and being able to understand what I am doing and why am I doing something. You know, if you, some traction devices, for instance, you can apply the traction device because that's bleeding control, and then you have to splint around the device to stabilize the device. But that splinting around the device is not life-saving, okay? So applying the device quickly is life-saving. Splinting around it can wait for later, if that makes sense. So it's, okay, you know, but you have to understand what you're busy doing. And I think that makes a big difference for prioritizing. It's not just doing something because you learned it like a parrot, you know, but really understanding, why am I doing this thing first? What is that thing second? What is that thing third? So generally your priorities, it's ensuring the person is stable as far as bleeding is concerned. So make sure all the external bleeding is controlled, make sure the person is kept warm so that any internal bleeding can hopefully help itself by maintaining the temperature, because it helps with clotting if you maintain the temperature. And then making sure the airway is potent and open and ready and protected, okay? Then making sure the respirations are correct. It doesn't help you know, you start fiddling with respirations, but the airway is closed. So you've got to open the airway, make sure the respirations are stable, make sure the person is circulating correctly. So they're circulating, you know, they've got adequate heartbeat, they're breathing adequately so that the blood is oxygenated. And then you deal with specific things related to shock. I think people tend to forget that. And when I say shock, this is a medical condition shock, not necessarily sticking your finger in a plug, right? It's, that could cause it as well, but it's not so specific. So it's the wide-ranging shock, which is essentially the thing that kills the person in the end. So managing shock and then looking after the spine, which is not only the spine, it's also head injuries and so forth. So anything neurological, to make sure that the person's neurological system functions and their body responses are adequate. And then you basically work through that over and over and over, right, to make sure that stuff stays stable and you keep improving it. And then you do your secondary stuff. So secondary things, it's things that are not immediately important. It's if you look at something like cleaning a wound, for instance, that's generally not a priority. So that is something I would do a bit later on. I'd first make sure everything that's going to kill the person now is dealt with. Then everything that's going to kill the person slightly later than now is dealt with. And so you go, you know, until you get to the point where, okay, it's the stuff that's going to be a problem 3 days from now, like infection and so forth. So infection control, splinting, packaging, cleaning up the patient, all that sort of stuff. That happens a bit later once everything else is dealt with. And yeah, it's basically just a system that a person needs to understand, and then, you know, you work from the side and you get through it.
Okay. Now, I think my next question sort of almost naturally follows on that, and that is, what would you say are some non-negotiable items that you need for a practical remote or wilderness medical kit? Let's say bush or wherever you are in a remote area in South Africa, and what gear do people tend to either overpack or, on the other hand, completely overlook?
Yeah. Yeah, it is actually, that is quite a difficult question sometimes because, no two situations are the same. So when you're considering equipment like that, one has to look at the mode of travel. So are you on foot? Are you in a vehicle? Are you on a horse? Or, what are you doing? Are you in a plane? All of that stuff influences not only what you take, but how much of something you can take. Then you have to consider the size of the group that you're with. Is it just for yourself, or you're looking after a group of people? And then the specific risk factors in that group. Do you have at-risk people? Do you have, say, elderly people? Do you have people with underlying conditions? Do you have people who are maybe very obese or something like that, so heart attack candidates and so forth? You know what I mean? So you've got to do a little mini risk assessment, and then you have to work from there. So in my experience, look at it depends where, I guess, who you work with, but the wilderness courses we run, when, especially the first time a person comes on the course, by the end of the course, he wants a bag that size, because now he wants to carry off hospital with him because he's learned all this stuff. And then you have to start sort of, narrow it down a bit, because if it's one thing if you're a, let's say, a 4x4 guide or something, and you can carry a paramedic size bag with you, but if you're a mountain guide and you're on foot, or a recreational hiker or whatever, you're very limited to what you can carry. So you want to say go light on the toys, because that is sometimes the thing that people start overpacking. And also go light on things that you can improvise. So I've hiked with guys who will pitch up on a hike, and they literally will have Kramer wire splints in their backpack, stuffed into their backpack. So those are those big orange splints that you normally see on an ambulance, that you can bend it into shapes. It's cool. It's not a SAM splint. It's a Kramer wire. It's a big heavy thing. Mm-hmm. And it's not so heavy, but it's bulky. But now the guys start carrying 6 of these things, and it takes up half the backpack. And you say, well, wouldn't you rather have more biltong than a Kramer wire splint? Because also I can make a splint from things that I find in the wild. I can make it from a sleeping mat, or I can make it from a backpack frame. So look at the things that you can improvise and rather cut there. And then the things that you cannot improvise, rather carry those. Okay. An example is the tourniquet. Once again, a lot of people think I can improvise it, and yes, you can. The problem is, how fast can you improvise it? Okay, it's one of those things. If you need it, you generally need it pretty fast. It's not something where you can sit and think about and go, I saw a nice whatever plant back there where I can go cut a piece off a time, formulate a tourniquet from a bobillon toe like Tarzan, something like that. But if you need it in seconds. So that a shop bought one is a better option. And then the other things that people sometimes neglect is the medication part. Because especially on urban first aid courses, people are generally taught that, you're not allowed to give people medication, or that type of stuff, which I understand in the legalities in a workplace situation and so on, but you're not prescribing medication. Plus, there is such a thing as the law of necessity, okay? Which means if I need to do something to save you, and it's outside my training, but I know I can perform it, I can perform it safely because it's life-saving, right? So there's the law of necessity. Plus, if let's say you're a hiking group of adults, and you don't have to say to the guy, listen, take 2 Panados and see me in the morning. You say to him, look, would you like a Panado? I've got one there. Pick one for yourself. You're an adult, because you can buy it for freaking pick and buy over the counter. So it's, people sometimes neglect that a little bit, and they also neglect the things that is hard to find, especially let's say you're used to South Africa and you now travel up into Africa, you're going north, especially for the first time. That is sometimes a big eye-opener to people. And, I'm not talking about Namibia and so on, a little bit further, a little bit more off the beaten track, it becomes difficult to find things. And especially medications, and then also prescription requirements is not always the same in every country and so forth. So packing the correct stuff and understanding how to use it it's useful in wilderness medicine. So the further you go and the further you're going to be from help, you would need to start looking at things like carrying antibiotics, for instance, and so on. But you require the knowledge that goes with those products, and you require the kind of a training of how to deal with it as well. So I think that's the other thing that's neglected often, of course, is the correct training that goes with this. So it's almost the first thing you want before you want to start packing the kit, get the right training for the right application as well, just like you want to get the right kit for the right application.
Okay, that makes sense. Walt, all right, I'm gonna end the first part of this 2-part series there. I think the info so far has been highly valuable. Ladies and gentlemen, Walther Meyer from Wildmedix. So just for the viewers and the listeners, because remember, we now also have a podcast on Spotify. So this video will not only end up on YouTube, but also on the podcast. It's called Quickshots. So please like the video, subscribe to the channel, smash that bell icon for us so that you can be notified of new videos coming out. And if you're interested in any of the training that Wildmedix offers, there will be a link in the description below. It will also be displayed on the screen that you can contact Walt and his staff and talk to them. It's definitely worth your while. And if you're interested in any of the lone operator training courses, as always, there is a link in the description. Check it out, and we look forward to meeting you on a range one of these days. That's it for me, Walt. We will talk again soon to cover part 2. I look forward to it. See you in a while.
Thank you.